Would you rather choose a life-saving treatment or food to feed your family? For many of us, this is just a hypothetical question, a cruel, impossible choice. But for countless people across the globe, this isn't just a game, it's the reality. Every year, millions of people are pushed back into poverty by healthcare expenses. These people are forced to choose between basic necessities and life saving treatment, survival and care. How did we get here? And more importantly, how do we fix this? Globally, healthcare is divided into two worlds. We have the public system that struggles with overcrowding and resource allocation, while the private system offers resources at a faster access, but at a cost not many can afford. According to WHO, in 2021, half of the world's population did not have health insurance. These people had to face the hefty costs of medical care firsthand without the cover of insurance. This caused 1.3 billion people to be pushed back into poverty, according to WHO. It is important to remember that there are real people behind these numbers, real family, real lives, like my house help Sunita. Sunita is deaf, and for years, her only connection to the world has been her hearing aid. But recently, due to a fragile bone in her ear, her doctor informed her that she could no longer wear it. For Sunita, losing her hearing aid doesn't just mean silence. It means losing the ability to work, losing the ability to communicate, losing the ability to connect with others. And the solution to this? A surgery costing 8 lakh rupees. 8 lakh rupees. That is 8 years worth of salary for her. She simply cannot afford it. And the worst part, her story isn't unique. It is just one of the million stories across the globe. For example, in the UK, John waits months for surgery that could end his pain. In the US, Sarah avoids going to the ER because it would bankrupt her. For me, these aren't just numbers and statistics. It's deeper than that. As someone who aims to go into the medical industry, it is saddening to know that so many people are being left behind. And the problem will only get worse. As living costs increase and job opportunities decrease, there is no assurance that my generation would be able to afford healthcare unless there are some serious changes. Because at the end of the day, what is the cost you would put on a human life? All of these stories highlight the problem. But what if I told you there's a solution? Across the globe, technology is transforming healthcare. Take minimally invasive surgeries, for example. Over here, a doctor makes a smaller incision instead of a larger one. So what does this mean? It means faster recovery time, safer procedures, and the best part, lower costs. Research shows that minimally invasive surgery has helped save 280 to 340 million dollars in the past and will save even more in the future. Another example is 3D printing. 3D printing helps mass produce medical devices and cuts down on the hefty costs of manufacturing. In Kenya, a boy received a 3D printed prosthetic arm, and the cost? Less than a cup of coffee. That's the power of innovation. Together, we can shift the narrative. We can ensure a world where no one ever has to choose between survival and care. A world where healthcare is not a privilege, it is a promise.